Sarwar.
Officer, we hear the same answer week after week, month after month, year after year, and things keep getting worse for people right across the country. And I've heard what the First Minister said, but it doesn't change the fact that he has spent the past week fighting for Michael Matheson when he should have been fighting for patients like Natalie and hundreds of thousands of Scots like her. And after 17 years of this SNP government, 1 in 6 Scots are stuck on an NHS waiting list. Our NHS desperately needs change. In 1948, we created our NHS. In 1997, we rescued our NHS. And on July 5th, the 76th birthday of our NHS, we will begin the process of rescuing it again. But that also needs change in Scotland, because the priorities of this SNP government are all wrong. Why is John Swinney more interested in defending Michael Matheson than defending our NHS? Why is John Swinney putting his party before the country? And why is John Swinney failing NHS staff and NHS patients every single day?
First Minister.
I reiterate that my primary concern is to make sure that people like Natalie receive the treatment they want at the earliest possible opportunity to address the anxiety and the acute health requirements that they have. And again, if Mr Sarwar would give me the details, I'll attend to that after First Minister's questions. But I have to say, some of the rest of what Mr Sarwar then went on to is just a little bit hollow. Wes Streeting, the Labour Shadow Health Secretary, said this on Wednesday morning: "The NHS is in crisis in every part of the United Kingdom because the decisions that are taken in Westminster don't just affect England, but Wales, Scotland and Northern Ireland." Earlier in the month, he had said, all roads do lead back to Westminster because of the austerity that we've suffered for 14 years. Now, in relation to that austerity programme, Rachel Reeves, the Shadow Chancellor, has indicated that the Labour Party, if it's elected to office, will not increase income tax, or national insurance, or corporation tax, or VAT, and that it's accepted very strict borrowing limits within very strict fiscal rules and very strict tax rules and squeeze spending budgets. What that amounts to is austerity on stilts from any incoming Labour government. And if that wasn't bad enough, Wes Streeting said yesterday that he will hold the door wide open for the private sector in the National Health Service. He will hold the door wide open. He went on to say, "We will go further than New Labour ever did. I want the NHS to form partnerships with the private sector that goes beyond just hospitals." So don't give me the stuff about the anniversary of the National Health Service. Labour's preparing to sell us out on austerity and the National Health Service and can't be trusted to deliver for the people of Scotland.